As physicians, it's really important that we understand that the social determinants of health impact the health of our patients profoundly. And as we think about
our patients are influenced by the communities and the environments they live in. And so in order to really meet the needs of the patients that we serve and the members of our community, we have to have a broader view of what public health means and what community health means and what population health means, because at the end of the day, it's all really just about health.
And social factors like housing, food insecurity or having appropriate access to food, education, employment, social structure, having interaction support socially are more important in terms of health outcomes than direct healthcare delivery.
Populations. If we can't understand what's bringing someone to the emergency room or is bringing them for an inpatient admission, it's really hard for us to understand how to prevent it, especially when they're already inside the doctor's office or the hospital. We've got to start thinking upstream to prevent some of those healthcare interactions if we really think we're going to bend the cost curve.
They can begin by asking the question. Start screening patients tomorrow, whether or not they have unmet social needs. There are tools that are available to do that in a high quality and reliable way, and then build off of that. But the primary focus is asking the questions in the first place.
So you can ask. I think that's the first thing that we're really trying to get physicians and all sorts of healthcare providers, nurses, and all sorts of those support folks who work in the teams in healthcare settings to really understand.
They have, and as physicians, it's really important for us to take the first step and ask our patients about access to nutritious food, about their housing stability, about their family situations, so that we can begin to understand for us to best treat their disease and help them achieve the outcome that we both want them to have.
The appropriate intervention. But when they're seeing them from a health standpoint for routine health care, that they need to ask questions along the lines of, what do you need? What's missing in terms of how do you maintain your health?
Now we're getting a better understanding of some of the other social determinants, such as food insecurity, homelessness, the effects of poverty and education, and how those impact upon the health and well-being of our patients. So we need to be more comfortable with understanding the impact of those and how we can find out how they're affecting our patients.